The ibuprofen question: can a common painkiller actually prevent prostate cancer? Recent medical news stories have suggested that common pain remedies like ibuprofen may have anti-cancer properties. But what does the science actually say? This guide examines the evidence to provide a clear answer. The inflammation-cancer connection. To understand the theory, we must first understand the link between inflammation and cancer. While acute inflammation is a healthy healing response, chronic inflammation can create an environment where cancer is more likely to develop. For prostate cancer, inflammation is a known risk factor. How anti-inflammatory drugs intervene. Ibuprofen is part of a class of medications called NSAIDs. Their primary function is to reduce inflammation. The core idea is simple. If chronic inflammation promotes cancer, then reducing that inflammation may, in turn, reduce cancer risk. Scientific inquiry has identified two specific ways ibuprofen might discourage tumor development. 1. Blocking cell growth promoters. Ibuprofen blocks enzymes called prostaglandins. These are linked to the unchecked cell growth seen in chronic inflammation and cancer. 2. Increasing cancer cell vulnerability. Research also suggests ibuprofen may act against certain gene activity, potentially making cancer cells more susceptible to treatments like chemotherapy. When researchers analyzed data on ibuprofen use in various cancers, the results were inconsistent. While some studies showed promising results for endometrial, uterine, and bowel cancers, the overall research shows mixed results. It is not yet possible to generalize a preventive effect for any NSAID against cancer. Why is the evidence so inconsistent? Many factors can influence the outcome of these studies, making it difficult to draw a single, clear conclusion. Key variables include differences in dosage, the duration of drug use, and the presence of previously undiagnosed or undetected disease in participants. When it comes to ibuprofen and prostate cancer specifically, there have only been a small number of studies. The existing research is not sufficient to draw firm conclusions. For example, a 2021 paper found that anti-inflammatories with smaller particles had a more powerful biological effect on prostate cancer cells in a lab. However, the study did not produce any information on actual cancer prevention rates in men. The scientific conclusion? There is simply not enough evidence at this time to justify a belief that ibuprofen can protect against prostate cancer. A critical warning against self-medication. Without a doctor's advice, consumers should never decide to begin using NSAIDs in hopes of reducing cancer risk. Use of any medical product, including over-the-counter medications like ibuprofen, without supervision can have harmful side effects. While the evidence for ibuprofen is lacking, evidence continues to accumulate for effective, lifestyle-based strategies. These have a proven positive impact, generating greater odds of a long and cancer-free life. The 4 pillars of a risk reduction strategy are: 1. A healthy diet. Focus on a balanced diet rich in fruits, vegetables, and whole grains. 2. Regular exercise. Incorporate consistent physical activity into your routine. 3. Stress management. Develop healthy coping mechanisms to manage chronic stress. And 4. Annual testing. Adhere to recommended screening tests and regular checkups with your doctor. Your key takeaways. 1. The idea is plausible, not proven. The theory linking anti-inflammatories to cancer prevention is logical, but the scientific proof, especially for prostate cancer, is not there. 2. The evidence says current, consistent evidence does not support using ibuprofen to prevent prostate cancer. Do not self-medicate for this purpose. 3. Direct your energy toward evidence-based strategies, a healthy diet, regular exercise, stress management, and appropriate medical screening. Please note, this content is solely for purposes of information and does not substitute for diagnostic or medical advice. Talk to your doctor if you have health concerns or questions of a personal medical nature. For more informational content like this, visit our website at sperlingprostatecenter.com.